Some of the structures that were able to be palpated or felt along the anterior aspect of the lower limb can also be palpated along the posterior aspect, as these structures are going to either be along the lateral or medial aspects of the limb. Let's begin looking at some of the structures that can be palpated or felt within the skin of the lower limb posteriorly near the gluteal region, beginning with the iliac crest and the posterior superior iliac spine. As we can see, the iliac crest on the left side here without skin is going to terminate posteriorly at the posterior superior iliac spine, often abbreviated simply as PSIS. And this can be an excellent landmark within the gluteal region. They can also palpate the gluteal fold, which is going to be the fat-filled crease along the inferior aspect of the buttock. On the lateral aspect of the hip, the greater trochanter is a good landmark that will help a physician identify the approximate path from the PSIS to the greater trochanter for the location of the piriformis, which can help them identify the approximate path of the sciatic nerve. At the knee, a physician will be able to palpate both the lateral epicondyle of the femur and the medial epicondyle of the femur from both a posterior and anterior perspective. Along the lateral aspect of the leg, just inferior to the knee, they can also palpate the head of the fibula, posteriorly and slightly laterally here at the back of the knee. Near the ankle, a physician will be able to palpate both the medial and lateral malleoli, which are going to be the inferior or distal extents of the tibia along the medial aspect and the fibula along the lateral aspect. Additionally, at the heel, they will be able to palpate or feel the calcaneal tuberosity, which is the inferior or distal attachment of the calcaneal tendon, which is the large tendon attachment of the gastrocnemius and the soleus.